Now, still more pandemic news. Many patients in Texas are dying in rural hospitals that are being forced to keep patients they are not equipped to care for. Now, the problem is the state's healthcare system has been utterly overwhelmed by people suffering from the Delta variant of the coronavirus. Let's listen in.
So I came here, and they did jump in and do as much as they possibly could, but they are just swamped. They tried to transfer me, and I heard some of the phone calls, and nobody would take me. And from what I understand, nobody's leaving here. So, but it's a sad situation.
Our staff and our physicians worked nonstop for over 6 hours trying to get him that transfer to a tertiary care center anywhere. And our emergency room doctor at the time actually went on Facebook trying to get him transferred. We did have a call from a physician near Austin who was willing to do the procedure, but we got a call back 5 minutes later that the administrator said, no, we're full, we can't do that. We truly believe that if we would have got him out of here in the normal time frame, he would have got to the VA in Houston and he would have survived. He didn't live. He died after he got to the hospital in Houston, which is very, very sad.
Lose a nurse essentially every day because that nurse has to call all of the hospitals in the surrounding areas to prove that we're doing our due diligence to get them elsewhere, and that takes hours, if not the whole day, spent phoning every hospital in the great state of Texas to see if anyone will accept your patient.
In the previous surges, we capped out at a little over 750 patients. Right now, we've been running between 820 and 850 patients. So the hospitals are quite full. In addition to that, we've had a growing number of other people who have needed those hospital services. So our beds are full. We continue to add some additional capacity as we can. And
totally unfair. And that major.
To help them, Texas is providing these uber-busy rural hospitals with respirators, oxygen, and other means of stabilizing their patients. It's also bringing in nurses from other states.
Thank you.
The West